I think masks are helpful when there's significant human-to-human transmission within our country. At the moment, that hasn't happened yet. It may change with time in the weeks to come, but at the moment, there's no significant human-to-human, or as far as we know, there's no human-to-human transmission within our country among Malaysians. It is currently useful. Masks are useful if you have to go to China. We are discouraging all non-essential visits to China. But if you have to go to China, or if you happen to be in China, then yes, it is useful to wear a mask. Or if there's any other region or country or city where there's significant human-to-human transmission. At the moment, that has also not been reported outside of China yet. But as I mentioned, things are changing. Things change rapidly in this disease. So what I say today may not be the same. May not apply for tomorrow. There are different types of masks when it comes to respiratory masks. You've got the single-ply masks, which are very, very thin. You've got the three-ply surgical masks, which are often used in hospitals. And I think by now people are also aware of another type of mask called the N95 masks. For the general public, if masks are needed, I repeat myself, at the moment, it's probably not helpful for this disease in Malaysia. If you are concerned about other respiratory illnesses in Malaysia, you habitually are worried about catching a cough and a cold or influenza, then yes, surgical mask can help to a certain extent, and the mask of choice for the public would be the three-ply surgical masks. The surgical mask cannot be used throughout the day because they will get moist, they will get contaminated over time, so you need to change it every few hours. At the moment, we are not suggesting the N95 masks for a few reasons. Number one, it is unnecessary for this infection, because this infection spreads by droplet spread, and surgical mask would work well for droplets, for a disease that spreads through droplet spread. So N95 masks are helpful when there's a risk of airborne spread, when the virus can spread through an airborne means. And surgical masks, for somebody to wear a surgical mask, they need ideally they need to be what we call as fit tested. So like in the hospitals, if we wear N95 masks, we are actually tested to see whether the mask fits the facial contours, and whether the mask is applied on properly, and so there's a check system where the mask is tested. The person is tested whether he's using the mask correctly or not. And there's also there's also a way on how to remove the mask without contaminating your hands as well. So that's why, because of the technical challenges, because of the possibility of that people might not wear the mask properly, and because it is not necessary, at this stage, we are not recommending the N95 mask for general public. Wearing of mask should always be accompanied with hand hygiene, good hand hygiene, because when you remove your mask, your hands can get contaminated. One of the things that we do in our wards is, so there are signs that we put up to say that, so if you're no hands above your neck, that means we don't want your hands to touch your eyes or to touch your nose. Okay, you can't touch your nose if you're wearing a mask, but you can touch your eyes. So if you are going to do that, you need to wash your hands first before that, because infections can spread. That is when we are working within infectious disease ward where there is a risk of transmission.